Sorry, I'm a bit all over the place because tonight I turned 23. So it's kind of...
Oh, really?
Yes.
Oh, happy birthday. How wonderful. I just turned 70.
Lovely, lovely. Like my dad.
Oh, really?
Mm-hmm.
That makes me feel great.
Still, no. It's like such a, I think there are some, our generations should be way more in touch with other generations than we are right now. And I really wish, like, this job is making me feel that. And I always ask the most random questions, like what made you go into that career? What would you say if you met your 23-year-old self? And like, so cool to meet all these wonderful people, like
Thank
working.
goodness for our youth. Thank goodness for our youth. That's all I can say. We appreciate that.
We appreciate also the amazing job that you all do for the community. I was a bit online stalking you, like reading bits and bobs. Like, I'm not ashamed of that. Like Melissa always jokes on that here at Until. She's like, you always go stalking our guests. And like, yes, I love that. Love it. So you were born in England. You're British,
Yes.
And then you moved to America, and then
yes.
Life got in a way, and then you applied somewhere, and then life you brought you someplace completely different. Can relate a lot since I'm in Switzerland. I'm Italian and German. I've lived a little bit all over Europe, and now I'm here. So like, can you tell me a bit more? Because it's so fascinating. What made you move to America in the first place?
Oh my goodness, that's such a long story.
I love to hear that.
I entered nursing school in 1972 in London. I went to Guy's Hospital in London. So I did my nurse training there. And I worked in, I trained to be an ICU nurse, intensive care unit nurse.
Yes.
And so I worked in ICU. I sort of ran the emergency department, accident and emergency department, we call it in England.
Yes.
Here they call it the ER.
we also call it emergency department in Italian. Yeah, that's fine.
And then I actually went to Holland for a year. I had the opportunity to go and work in Holland for a year, and I like to travel. So in the late 70s, I went to Holland and worked in intensive care in Den Haag, in Brunnovo Ziekenhuis. And I did that for a year, and then I came back to London, and I actually didn't have a job, but I did sort of private duty nursing.
Yes.
So I worked in various intensive care units around London, usually the night duty. And then one day I got a call from my agency asking if I would go and look after this gentleman who had had a massive brain hemorrhage.
Mm-hmm.
And so they told me to stop what I was doing because they needed a male trained ICU nurse. And so I went to take care of this man. I had no idea who it was. And it turns out he was the Earl of Althorp, Lord Spencer, Princess Diana's father.
Princess Diana, yeah. Salty on that. So that's
funny. And I'm telling you all this just to let you know how I got to the United States.
Yeah. Love that. I was living in the Netherlands last year, so that's why.
Oh, really?
Yeah, I was living in Utrecht for for a while.
Yeah.
Love it.
Yeah, I travel around the Netherlands a lot, obviously. And the rest of Europe as well. So I took care of him. He was in intensive care for a long time. He gradually, got better. And I was asked to go back with him to Althorp, which is his country home in Northamptonshire in England. Mm-hmm. And I lived there for some time to rehabilitate him. So I spent a lot of time with the family. I met Princess Diana when she was 17 years old. She used to come and visit with him in London. It's when she was a nanny, actually, so she was quite nearby. And I've been in touch with her ever since until, unfortunately, she passed away. But so at the end of that period, they said to me, "You've been working so hard all this time. We want to send you away on holiday somewhere." And they let me go wherever I wanted to go. And I was sort of interested in the United States and the healthcare system in the United States.
Oh, yes.
Just to check it out. I know. That was a mistake, right? Just to check it out. And so I decided I would like to go to San Francisco.
Oh,
I heard so much about San Francisco and being gay. you know,
Yes.
the gay mecca of the United States, in those days.
Mhm.
And so that's how I ended up going there for a month. I stayed on vacation there for a month, and I really enjoyed it. And so I actually returned a year later. I didn't have a job. I just wanted to get a feel for the country and the people and the healthcare system. And so I was there for a year. And I was actually offered a job. It was around that time that they were going to open up the AIDS unit at San Francisco General.
Mhm.
And so I just thought, well, let me go and interview and see what it's all about. And I was interviewed, and they really wanted, they said they would like to hire me. They were just opening it up. But unfortunately, they were not hiring foreign nurses in the Bay Area at that time.
Okay. Because of visa, residency
Well, no,
permit.
it was more, they told me that Medicare and Medicaid had withdrawn all their benefits from the Bay Area hospitals. I had no idea what they were talking about. So there was an issue with Medicare and Medicaid, and they were actually putting some of their nurses on short time as well to overcome this problem, which I didn't know what it was. And so they were not being able to hire foreign nurses. So I did my nursing boards in California. So I got my license in California there while I was just hanging around. And then California Board of Nursing said, well, why don't you try New York? They may be hiring. So I contacted New York, and they were not hiring either. A New York Board of Nursing told me to try New Jersey. And I had no idea where New Jersey was. I didn't realize it was just across the river from New York. And I applied to University Hospital in Newark, New Jersey. And that was in 1984. I started working there. And I've been there ever since until I retired. This Monday, actually, I retired this Monday.
This past Monday or this Monday on the, if I'm
Monday,
not wrong,
the 28th, February the 28th was my
28th.
last day of working. Yeah, I've been in healthcare for over 54 years. So it's a little odd that I'm now retired, but
you know, it never leaves you. Honestly, that's one thing that I can say. Like the passion, the work that you do, it sticks with you. Sorry, your life for your life. It will be that. It
will
will
always
be
be there, I guess. Yes, I have.
Yes, it's a part of you.
I've been very privileged to work with royalty and the citizens of Newark, who I love dearly. So yeah, I've had a lot of experience and a lot of privilege in working with all these people.
It's incredible because so many factors were overlapping at the same time. You know, so many synchronicities. It was San Francisco, it was the 70s, and then it was New York and New Jersey in the beginning of the 80s. I can't believe, I can only imagine how incredible that must have felt, the energy, the commitment. And if I'm not wrong, I'm not sure which US president it was at the time. I know that Reagan played a huge part during those years.
In doing nothing.
Yes, he only said the word, if I'm not wrong, he only said the word AIDS like once during the whole presidency. I may be wrong.
And he choked when he said that. He choked on those words when he said it.
Yeah, while as you sure know more than me, Princess Diana was opening up to HIV, to the HIV community, to the queer community. She was like the first one who would hold hands and shake hands when doctors refused to treat HIV positive patients. So it was that massive.
She was a great role model in that respect. Absolutely. In fact, I was going to invite her to where I work. That was on my plan. Unfortunately, that didn't pan out. But I'm sure she would probably have come.
Yes, and she would.
We corresponded quite a lot, and she knew about my husband, Gary Paul, and she was very kind. She was a good soul.
Yes, it was indeed. I talk a lot about community building and working for your community and creating community. So there are so many curiosities, so many questions. First, I'd like to start like, what made you interested in pursuing a career in nursing? And then what made you what made you choose an emergency department? Because I have a little backstory here that maybe could explain things a little bit. My favorite uncle, who is also retired, he has been working in the intensive care and emergency department at University Hospital in my hometown for his whole life. And since he's my favorite uncle, that my other uncles won't be seeing this interview, like he has always been very open to what it takes to work in such a department. And so I've always been very close with these subjects. And then, of course, I'm really curious about what made you choose such an intensive, life-changing, it is life-changing department.
When I finished grammar school, of course, you have to apply to universities and colleges and blah, blah, blah. And I really didn't know what I wanted to do. I was sort of interested in healthcare. I applied to a university, a few universities for dentistry. And I actually was accepted to Sheffield University in England to do dentistry. But the more I thought about it, the more I thought, oh my God, do I want to spend the rest of my life looking into people's mouths? And it's like, it's not really what I want to do. And when I was 18, I'd finished grammar school and I didn't quite know what to do. And I actually had volunteered in the previous years at a local hospital. Wow. On Saturday mornings, I would go as a volunteer and work on the wards in the local hospital. And then I applied for a nursing auxiliary position, they called it at that time. It's like a nursing assistant type position at a local hospital, which had the emergency room there. And so I worked on night duty there, doing nursing auxiliary work on the wards. And then they asked me if I would like to work in the emergency room. I thought, my goodness, yes, I would love to. And that's really what hooked me on emergency and ICU. Was working in this trauma accident and emergency department as a nursing auxiliary, but they allowed me to do so many things and observe so many things that I really liked the adrenaline rush. I liked the excitement about, thinking on your feet, making decisions in a short period of time, because that's what you have to do, right? And it really intrigued me. And I met some wonderful nurses, and we call them sisters, right? Ward sisters. In England, and they're the managers of the units and things, and they taught me so much, and I really thought to myself, I would really like to do this. It's something that I would really like to do, because you're sort of hands-on with the patients 24 hours a day. You don't just go in and come out, and so I really enjoyed that connection with patients. And so I applied to the Thomas Guy's School of Nursing at Guy's Hospital in London, which is quite a well-known hospital, worldwide known hospital. And so I was accepted there. My class, the January class in 1972, there were 80 nursing students, and there were only 2 males.
Yeah.
And the other male dropped out after a year. He couldn't take it anymore.
Left
so
alone.
I was the only male in my class who sort of graduated. And then, I became a staff nurse on the surgical unit. And then I did an intensive care course, which they offered. And it was cardiothoracic and intensive care. Okay. And that's what stuck with me. I really, really enjoyed the excitement and the adrenaline, and also making an impact in people's lives. Yeah. So that was my niche for quite a long period of time. Yeah.
Was anything impactful that made you feel closer to the LGBTQ+ community and to community care, and knowing that your job as a nurse would have gone a little bit forward, doing the extra steps for us, for the LGBT community, for the HIV community, and was
I really didn't come out until I was out to my brother and my friends while I was in Holland, actually.
Yes. Okay.
Because I knew I was gay, right? You're gay, right? For all your life. But I never really came out to anybody. And bear in mind, this is like in the 70s. And so it took me to leave the country to actually come out. So I came out on the telephone to my brother and to my friends. And the friends that I trained with, there were 6 of us. We're still in touch together. We have Zoom meetings every week or every other week. So there's a little group of us called the Bramham Gang. And we still meet after all these years, after 50 years.
That's wonderful.
Yeah. But I really didn't get involved in the gay community. It was really when I went to San Francisco, right? Obviously. And I started to sort of think, this is great. I will say, I lived in Castro in San Francisco. And after a while, I thought, oh my God, this is too gay. It's like overpoweringly gay. After living my sheltered life. But I began to relax, and I began to understand and understand the issues that were going on. And so that's when I really got engaged with the issues surrounding LGBT populations, especially with the HIV/AIDS epidemic rearing its ugly head in that time. It's sort of, there was this, connection, and anger, and just a lot of feelings that boiled through that really made me committed to LGBT populations. Absolutely.
Mm-hmm. We had a very interesting, we took a step back, a couple of interviews before, and we analyzed like a bit the history of what was happening during the 70s in San Francisco when I was interviewing the, if I'm not wrong, John Cunningham, so San Francisco Memorial, National Memorial, and what was happening and the response of the LGBT plus community and all the women and on the lesbian women that helped
absolutely.
the gay men
And straight women too, and
straight
cisgender, straight women too. They really rallied, the lesbian community and straight women, especially in New York. They were instrumental in really coming to the fore and helping out with the LGBT populations. Absolutely.
Do you think that the stigma that surrounded HIV was the biggest challenge to overcome at the time, or were other factors that played a role? For example,
I think
religious.
not only HIV, but it's also being LGBT, right?
That doesn't
in
help.
those years.
Yeah.
It's like a double whammy, right? So
Yes.
you have two things going on, sort of struggling with your identity and sexual orientation, and then you have HIV thrown into that mix with that population. All the stigma then blew up, right? And it's still there today. I have to say, it's still there today. We still see patients stigmatized in one form or another. I think we're much better than we were, but we still have work to do. Yeah.
Do you think that the challenges that we faced in the past are so different than the challenges that we face today because of globalization and maybe hate speech or polarization of society because of social media? Then it is a very specific, like I think it plays a role. Like technology can bring people together, but it can also bring them incredibly far apart.
It can knock them down too. And certainly here in the United States at the moment, what's going on in various states in the country are just appalling. I mean, you have Florida, the governor of Florida, who's banned the use of gay in schools.
Sorry, I missed that. Me and my American flatmate missed that. Oh, wow, really?
Yeah, and I think that the state legislature has passed it, that you're not allowed to use the term gay in the school system. So he's now ostracized all the gay kids and the transgender kids. It's sort of negating who they are, right? Mm-hmm. If you can't use the terms, it's negating that. And this is a recently passed, just a couple of weeks ago. It's outrageous what's happening. And the same in Texas, the governor of Texas and the transgender populations there, they're just sort of not acknowledged that they exist. And so that's a huge step backwards. So I think we're going to see another sort of uprising, I hope.
I hope,
you know, as the gay community sort of rallied in the 70s and 80s and 90s, I think the time has come where, and I think it's partly because of social media, right? People are getting more misinformation, like we got misinformation about COVID. We're getting misinformation about the LGBT populations. And I just feel, I can feel the rumblings and the grumblings again on the grassroots levels to sort of rise up again and fight back. So I think we're sort of coming full circle again. And I think it is part of what you say is the social media and a lot of misinformation. Yeah.
Of course, being with patients 24/7 isn't easy, but it's something also that enriches your life. It gives you different perspective. Where there was maybe a specific moment that changed your mind about the subject that you never thought you could think that way. It was like where like someone that you met. Like these interviews are continuously opening my eyes on so many different subjects. And of course, like if I were to pick a couple of moments, there would be, for example, me like bawling my eyes out during an interview with John Cunningham because I was like too moved. It was too beautiful. I was just like sobbing. Like
yeah. Well, I actually went into HIV care it was weird. I met my husband. We've been together 31 years. And
Congratulations. It's
thank you.
nice.
And he was a guy who was an AIDS activist way back in the day, and has been and still is, right? And so meeting him, and then I was getting tired. I was a manager of the surgical trauma intensive care unit at University Hospital in Newark. And the more I got into that administration role, I was further away from patients.
Mm-hmm.
It didn't feel good. It wasn't fulfilling my need, right? And so I decided I would go back to school to become a nurse practitioner. So I joined nursing school at UMDNJ, which is no longer there, but it's Rutgers University. And to do that, I had to step down from my role in intensive care, and I went to work in the infectious disease practice at University Hospital, which is really an HIV practice, right? So that's where I really got the hook. Gary Paul sort of helped me sort of think about that, and then I sort of went there, and that's where I started touching patients and meeting patients who were literally dying of HIV and AIDS. It was very overwhelming, meeting patients and then seeing them die with these horrendous opportunistic infections. It was very, very difficult. And the one thing that really hit home was when I had a young man. He was from South America, and he was very, very ill, and he had Kaposi's sarcoma, and we cared for him, and he passed away. And my attending physician asked if I would like to go to his autopsy, which seems very macabre, but I was so intrigued about what this Kaposi's sarcoma was, and how did it kill people when it's only supposed to be a skin cancer, right?
Mm-hmm.
And so I actually went to the autopsy of this young man. And when they were doing the autopsy, they found Kaposi's sarcoma in every organ of his body, in his lungs, in his liver, in his kidneys, in his bladder, his intestines. And I thought, wow, this thing is powerful. And I think that was a moment where I thought, oh my God, we've got a lot of work to do here. And then it just took off from there. And I stayed in HIV care ever since.
I think those moments really have a mark on you. They really change you.
They never go away.
You kind of,
which actually is a good thing, because it keeps that fire in your belly, right? You have these horrible memories of patients and what they were going through, but you have to hold on to those memories, because that's what keeps your fire in your belly and keeps you going. And so I would never ever let those memories go away.
Mm-hmm. That's very brave. Also, I've always thought that rage can be something empowering and positive rage. I don't know if because I'm a woman, and so normally society would expect us to never be angry, to never be enraged by something.
I've seen some angry women in my time. Helen Miramontes is a good example, right?
Yes. What a
wonderful, wonderful activist, and she had a fire in her belly, and she taught me a lot of things in the past. But right, it's good for women to be angry and have that fire in your belly.
It can make you really go the extra mile. It can bring you like it's always, the fire is always there, even when you're sad, even when your community has been hurt.
Right.
What has happened during the pandemic.
And it stretches your mind too. It makes you think further, right?
Yes.
Which is really, really good.
How was working? I know that maybe it's a very common question, but something that I've always been interested in also lately, because I would love to do my research project on that, is how community care was shaped during the COVID-19 times. And by community care, like access to resources and therapies and parental counseling and everything. Was it heavily impacted? We often have these conversations here until.
Yeah, I spent my last few years, I'm the Director of Healthcare Services for the Francois Xavier Bagneux Center, which is a center within the School of Nursing at Rutgers. I worked there for 22 years. and as a nurse practitioner, and also I managed all the grants, the Ryan White grants and stuff like that. So we were working in our community health center. It's a primary care center run by nurse practitioners from the Rutgers School of Nursing, which is great. But I remember when COVID really hit, it was around March of, my years go by so quickly. Was it 2020? I can't remember.
Yes.
And we got this call. I remember it was a Friday, and we got a call in the evening, a text in the evening from the office manager saying that one of our staff members had come down with COVID. So we had to close the clinic, right? Mm-hmm. And over that weekend, all of the staff worked together to try and put into place how we were going to continue to care for our patients when the clinic is closed.
Yes.
And we did it over the weekend. And we started doing, we're calling our patients every day until we could set up systems like Zoom and telehealth visits, which we've been doing now 2 years. So we actually kept connected with our patients through telephone and through telehealth Zoom meetings. But the fact that we did that over a weekend says a lot for the staff of that clinic. And it wasn't just us, it was all the clinics in the area and the hospitals in the area. I remember our hospital, University Hospital, was impacted so awfully. And we had like 20 or 30 refrigerated vans outside in the parking lot, in the car park, to put bodies in. The mortuary was so overwhelmed, and we sort of had 20 or 30 vans there, which were there for a long, long time. So the community was really, really impacted, but the whole place shut down. The whole town of Newark shut down, but the healthcare continued because we had to reach out to our patients. So it was a huge transformation in how we provide healthcare, right? But our patients really liked the telehealth visits because they were isolated at home, right? But we still had that connection. I mean, they could still see our faces and hear our voices. So they actually really, really enjoyed doing the telehealth visits. But it had a huge impact on mental health, behavioral health, and society in general. And I think some people are still reeling from that, right?
Yes, I think we also mentioned long COVID and also everything that has been impacting our mental health, from the socioeconomical instability to teens that have lost formative years of their life.
Yes, absolutely.
And especially I think when for somebody living with as a HIV positive person, this pandemic could have triggered, of course, this sense of helplessness or what is happening, I can't control everything, because like the government says one thing and then it says the next. It was communication wasn't clear.
Right.
We also have to think about our collective past as a community and what can be impactful. I've heard, I've read that you also worked for the on so many projects regarding the intersection between African American community and the HIV positive community. Yeah, I really stalked you. I'm really got a hand on that.
Well, actually, Newark has a huge African American population, right? So just being in Newark, I always say that Newark found me. People say, "Why did you go to Newark?" It's like, ugh, because Newark is the biggest city in New Jersey. A huge African American community. They actually had riots in the 60s in Newark, race riots in the 60s in Newark. So a lot of areas were destroyed. But I really warmed to that community. I mean, they were so welcoming to this Brit who just showed up in this hospital. But a lot of my patients are African American. And so you have to stand back and really understand and listen and observe to really understand where that population, where that community is coming from. And that's what I did. And then, of course, my husband, who's Black, right? He introduced me to a lot of things when we first met. And he was working at the Gay Men's Health Crisis at the time. He volunteered for them for quite some time. He was a buddy. So they were paired up with guys that were dying of AIDS. And so they would go to their homes and take care of them and go shopping for them and that sort of stuff. But while he was working there, he realized that, gay men's health crisis was just serving the white gay men in Manhattan, which is a good thing, right? It's a good thing. They did a lot of good work. But he realized that, well, where is gay men's health crisis in the Bronx, in Harlem, in Brooklyn, where a lot of the African-American communities were? They were not serving that community. And so he actually was hired and he worked in prevention. And they actually started the People of Color program for African-American, Latinas. And so that sort of expanded within the Gay Men's Health Crisis organization. So he introduced me to that as well. He introduced me to the ball scene, the house ball scene. I don't know whether you know about that.
Oh, yeah.
Pose, have you seen Pose?
Yeah. Yes, I saw it. I love it.
Paris is Burning. And so he actually, and he so inspired me, but the house community, which had been around for a long, long time, but it's very underground, and you only knew by word of mouth. You weren't allowed to go into these house balls, just drop by and see them like you can now. And so he really felt that there's a need to do prevention messages in the house ball community, right? Which wasn't being done. And they were very, very high risk, as you can imagine.
Yes.
So he actually called together a lot of house mothers and house fathers within the Newark area of all these houses. And they met and he told them what he would like to do. But he didn't want to be sort of pushing prevention down their throats, because these kids were there to enjoy themselves and to compete, yes. Right? And so it was this fine line of giving the prevention messages, but not really being pushy about it.
Yeah.
And so he came up with the idea of cigarette girls. Do you know the concept of cigarette girls? They used to be in the movies in the 70s.
Oh, yeah.
And the 50s.
Yeah. Sellers.
And they would carry trays, right, of, drinks and ice cream and cigarettes and whatever. And so he had these volunteers, these trays, but the trays were full of condoms, lube, HIV information, and that sort of thing. So that's how he they were very in the background, but they were actually circulating and giving out information. And that's how he started infiltrating that ball scene. And he created the House of Latex.
Mm-hmm.
So his prevention intervention was called the House of Latex. It wasn't a ball, it wasn't a house, but actually it is a house now. The House of Latex is a huge, well-known house in New York. And it's a part of Gay Men's Crisis. And they get money now. He didn't have any money to do any of this stuff, but now they have a budget. And so that's how the House of Latex in New York started with Gary Paul. So he introduced me to that community as well. And I saw there was a need. We both saw there was a great need. And that's really how we got to focus on that community. And then, of course, he started his own agency, which is still running to this day. Wow. After 22 years. We actually started that agency in our kitchen.
Oh.
Yeah. He realized that there was no specific organization in the Newark area that was serving the young gay youth, which have different needs than white gay youth, right? And so he decided, and he got together a few friends, and we sort of started to talk about getting an agency which was specifically for Black gay youth. And that's how the African American of Gay Concerns started. The state heard about it and they was interested and they funded him, and he's still going. Except now he's doing trans work, right?
Yes.
It's so funny how things evolve, but how you've got to listen to the community about what the needs are and see what the needs are instead of just putting together programs which are very generic. You really have to see what the community needs are before you can develop programs. And so he started this agency for young gay men, Black men, and they were coming in. But then he saw these teenagers coming in after school, and they would come in, they would go into the bathroom, and they would come out in sort of Daisy Dukes, little shorts, and tops, and wigs, and makeup. And they just hung out in his agency because it was a safe space for them. And it's word of mouth, really, what goes around in the community. And so he found that this population that he wasn't aware was there were coming to his agency. And so he said, there's a great need here. And what we do for young gay Black men is not the same that you can do with the trans youth, right?
Mm.
And so again, he evolved programs for the transgender community, which to this day he's doing still.
Well,
I must say, I
yes.
must say, he puts on a symposium everywhere on the International Transgender Day of Remembrance. And until there's a cure, Nora Hanna has been one of the best supporters of that symposium. It's called Mascara. And Nora, and Until There's a Cure, always donate giveaways for door prizes and raffle prizes. And Until There's a Cure has always been a huge, huge supporter of Mascara and his agency. So we're very, very grateful for Nora and Until There's a Cure.
We all are. I think like we're
Oh,
like
absolutely, absolutely. I mean, I was first introduced to them at the Association of Nurses and AIDS Care conference many years ago, and which is where I met Helen Miramontes. And they were there every year, and so that bond. And I'm the bracelet queen, right? So I love bracelets. And so you probably see I've got a load of
I love it.
bracelets on.
Yes.
So yeah, that's how we got connected with Until There's a Cure as well.
You know, like I already said, we talked a little bit about what made you choose nursing and the medical field. And as a patient, I would always hope to find practitioners that are well informed regarding LGBT plus identities and gender, identity politics, and of course the HIV. So do you think, like, what would you say it's like one of the must have qualities that a practitioner dealing with such sensitive topics as sexuality and gender and status, what are the qualities that they should have when it comes to working with patients on a daily basis, like in close contact?
You have to listen. You have to listen and ask the right questions. You know, if you don't ask the question about, you know, who you're attracted to, what is your lifestyle, what is your orientation, how can you address the issues and problems that that person has? So it just starts out with getting to know your patient, right? And asking the questions. If you don't ask those questions, a lot of practitioners choose not to ask those questions because they really don't want to know. Because I think some of them feel that they're not adequately prepared to take care of LGBT populations. But of course, we're all able to open our eyes and our ears and our hearts to do that. So you can choose not to do that. And I think a lot of practitioners do that using the excuse that they're not familiar with that population.
Yes.
It's like myself. I've been doing this for a long time, and our program actually started out, the FXB Center started out as a pediatric HIV program for newborns, you know, who were born with HIV. And so we started out with 700 children, and a lot of them died during that early period, but a lot of them have been with us all along, and they're now adults actually. And a few years ago, we had a pediatric attending who would not really acknowledge gay youth. He wouldn't acknowledge it. He would just treat them like they were straight youth. And we had a lot of problems with him. And there was one particular young lady, she was 16 years old, who was of male to female, but he would not even acknowledge that this was her problem. And she was hospitalized many times with drug overdoses. 15 and 16 years old, she was admitted several times because she wasn't coping with it. And the staff just didn't know what to do. And so I said, I will take care of her. I had no idea about transgender care. I understand the concept and the issues because Gary Paul and I had already sort of worked as an agency on that. But in terms of medical care, I had no idea. So I found out how to do it. I mean, it's not complicated, right? And this young lady now, she's sort of 26, 27. She's never been in psychiatric care ever since. It was like a flip with her. Wow. To know that someone was going to take care of her and make her feel like a human being.
Yes,
Um,
being
but it's
seen,
not
being heard.
difficult. It's not difficult. It's simple. But you have to have the heart to take care of human beings, right? If you're a medical provider, you have to take care of everybody. You can't pick and choose and cherry pick who you take care of. That's not the way healthcare should work.
Same
But
for
it does.
Jen.
It
But it
does.
does. It does.
Yeah. Yeah.
Totally. The way we see accessing resources that are typically built for cisgender men,
Absolutely.
while there is like a whole community of us, like the LGBT or
Yeah.
there is also a trans community and the people of color, and it's like crazy.
Yeah.
One step back is I really can't miss on the opportunity of asking. You talked about San Francisco and New York and ending up in New Jersey while also visiting Europe. So there, I think like the memories that I would love to hear all of your memories. I think that would be nice. They're really life-changing. Traveling opens your mind. It's hard as an international student.
Oh,
It's
yes.
like a first year abroad for school, being traveling on and off.
It is hard. It is hard.
It is hard.
But it's
worth
also
it.
fascinating.
Yeah, you and it goes up so fast. Can't believe it's already March.
I know.
What enriched you the most of traveling and getting in touch with so many communities, like community care? Let's talk about community care and what did you gain from all of these interactions and friendships?
I gained so much about. I mean, I enjoy learning about people, right?
Yeah.
And I was brought up in a small town in the north of England, in Derbyshire, the Peak District. Beautiful area, beautiful green hills. But I really wasn't exposed to anything particularly.
Okay.
I had these feelings that I was gay, but didn't really know because I didn't know everybody else that was feeling the same way. So just being able to, and when I moved to London, it's like, wow, this big city, right? With all these temptations and all these people. But just watching, I'm a people watcher. I love observing communities and people.
Yes.
I like talking to them. I like finding out about them. And I think that's what I like about community care is getting to know your community. Because if you don't know your community, how are you going to take care of them? So again, it comes back to talking to people, listening to people, finding out what they're all about. And traveling has done that so much in different countries. That bottom line is human beings are human beings, whatever nationality you are, right? And we see similar things in similar people around the world. And so we have that connection. So yeah, I found travel fascinating, and that's why I did it, is to meet different communities. And like I said, the gay community in San Francisco, I found a little overwhelming because it was like all gay, where I was living in the Castro. It's like, oh dear God, find me a straight person, for goodness sake.
But not.
Yeah. So you can have too much of a good thing as well. But yeah, I mean, I just love meeting people and talking with them and finding out where they're coming from.
Do you think there is now in 2022 one particular bias that people still have regarding the job that we do as raising awareness, educating or interacting or communicating between realities?
I think it's still there in some populations. It depends where in the country you are, especially in the United States. I mean, there's still a huge stigma for LGBT populations, HIV, a lot of health disparities in the indigenous communities, African Americans, Latinas. There's still that going on around the country. Absolutely. I'm very fortunate in New Jersey. They're very well, apart from South Jersey, maybe a little bit. But then that sort of helps you continue, right? When you get support from your local communities. Where I live in South Orange in New Jersey and Maplewood and Montclair, great LGBT supporting communities. I mean, they're just wonderful, wonderful communities to live in. But I'm fortunate, and Gary, Paul, and I are fortunate to be living in this community. And that's why we chose to be here, actually. But other areas, not so much. There are still kids struggling with their identity and their sexual orientation. And their surrounding communities are not supportive or acknowledging even that they exist. So I think there are a lot of kids still struggling. And then, like I said, with these legislators coming in from Florida and Texas, the legislators coming out with these new laws, which are ostracizing that population, is just outrageous to me. In 2022, that these things are happening. And of course, there's one man that unleashed it all, right? That we no longer have as a president, but he's the one that allowed these sort of people to come out of their shells and start fighting.
And normalize something that shouldn't be normalized.
You know, the evangelicals, and they're just coming out of the woodwork now because of him, because he allowed it to happen.
I feel, for example,
I can't even say his name, but we know who we're talking about.
Yeah, sure. For example, like the fact that conversion therapy is still something that is still happening.
Yep.
I can't really wrap my head around it. Totally.
I know.
In the world, like globally, it's not only a problem in the United States. It's a problem that we all have, like globally speaking.
Yeah.
As a community and as like work population. This is a very interesting question that our guests like a lot, and it's like my signature question: is there a quote or a saying that you live by?
Oh my God, I hate things like that.
It had to happen at some point or another. I had to find somebody who hates this thing.
Because I can never think of one. That's the problem.
Okay.
I'll have to think about that. Because I say that because there's so many things that I've heard in my career of that sort of rings that bell and think, oh yeah, that's good, that's cool. But thinking of one in particular, I can't bring one to mind right now. I'm 70. Give me a chance.
We could go for the something that I always say: take what resonates, leave what doesn't. That's like the whole holy grail of quotes and sentences and everything. It's like we take what resonates and we leave what doesn't. So it's like we are a mosaic of so many different things and philosophies and things that we love. Which brings me to the second question. If you were to meet you're 22, tomorrow I'm gonna be 20, like tonight I'm gonna be 23, so the 23-year-old self, what would you, is there something that you would like to tell him, like a pat on the shoulder and be like, it's gonna be okay? There's not gonna be no third world war, please.
Oh please, that is so unnerving to think about. I think keep hope alive. I mean, there are people in your communities who love you, who care for you, and who will fight tooth and nail for you. Don't give up. There is always someone out there who you can turn to support you. And I like to think that we are going to be okay. I think we're going to be okay. Yeah. I have to hope that we're going to be okay, but we're the ones that have to make it okay, right?
Yes.
So I think if you feel passionate about something, you just got to follow that passion and keep that fire in your belly, and you're going to be okay. You may have some pitfalls, some ups and downs, because that's what life is all about. But keep that hope that everything is going to be okay, and it will be. It will be. I mean, I've been through some really awful times, but I've had people around me supporting me that not necessarily are my friends, but who I can look up to or can reach out to. And I think if you can find that one person that you can feel is supporting you and caring for you and loving you, you're going to be okay. You're going to be absolutely okay.
Wow.
There's a lot of good in this world.
Yeah, and we
and we only hear about the bad. We very rarely hear about the good. But there is so much love and good in the world that we have to embrace that and keep our hope alive, you know.
Wow, it was really nice. Thank you so much.
Thank you for inviting me. It was so kind of you.
I'm really happy that I get to do this on the day before my birthday. Can I say that? It's like
I know.
I had planned for this. It was nice.
Happy birthday.
Thank you. It's like so lovely. I will cherish this memory like forever. It's like so nice, and thank you again. Please, let's stay in touch somehow.
Absolutely. Please do.
We're gonna keep
and
working.
Happy birthday. How wonderful. 23 years old, and look at you. You're already on your way. Right?
I want to keep
on your
doing
way and
this.
making a change in the world.
This is like,
that's really good to hear.
This was like one of the biggest gifts that 22 brought me until working here and meeting all these wonderful people from all over the world. And one day I
So
really
you
hope
have
to
hope,
visit
right?
the US. Yes.
You have hope. Yes.
And we should all have. Thank you. Thank you so much.
Thank you so much.
Have a wonderful weekend, basically.
And I'll be raising my glass to you tomorrow.
Thank you.
I'll have a drink with you tomorrow, okay? Happy birthday.
Thank you. Thank you again. Bye. It was lovely.